First, we're going to start with anterior palpations. First, we'll find the patella, the large sesamoid bone that glides over the knee joint, which is commonly called the kneecap. Next, we'll be palpating the trochlear groove. To palpate this, you'll need to move the patella either laterally or medially. And this is just the track that the patella glides on. Next, we'll be palpating the patellar tendon. This is from the inferior pole of the patella, and it inserts on the bony prominence of the tibia, the tibial tuberosity. Next, we will be palpating the quadriceps tendon. This tendon runs from the end of the quadriceps muscle to the superior pole of the patella. The tendon encompasses the patella.
We're going to start with the medial palpations. First, we're going to palpate the joint line and meniscal windows. Have patient supine with leg bent at knee joint. Grasp the proximal posterior lower leg with fingers. Find the patella tendon. Place thumbs on either side of the patella tendon. Follow the depression medially and laterally. This depression is the joint line. Next, we're going to palpate the medial tibial plateau. The patient is still lying supine with leg bent at knee joint. Grasp the lower leg from the front with fingers in popliteal and thumbs in the depression of the joint line. If you press inferiorly, you'll be palpating the tibial plateau on the medial side of the patella. This is the medial tibial plateau.
Next, we'll be palpating the tibial tubercle, aka the tibial tuberosity. If you follow the infrapatellar tendon distally, it will insert onto a bony prominence. Where it inserts is the tibial tubercle. It is also the insertion of the pes anserine. Next, we'll be palpating the medial femoral condyle. Still have the patient supine with knee bent to 90 degrees. Place thumbs in the meniscal windows. If you press upward on the medial side of the patella, with thumbs still in the joint line, you'll be palpating the medial femoral condyle. Next, we will be palpating the medial femoral epicondyle. So starting from the femoral condyle, you will just palpate medially until you feel the sharp edge of the medial condyle. If you palpate medially from that, you'll be on the femoral epicondyle. Next, we'll be palpating the adductor tubercle. So beginning at the medial femoral condyle, you will palpate medially and posteriorly until you feel a bony prominence at the distal end of the natural depression between the vastus medialis and the hamstring muscles. This is the adductor tubercle. Now we'll be palpating the medial meniscus. So you'll have your patient sitting with the leg off the table or chair. Internally rotate the tibia and palpate along the medial joint line. With internal rotation, the meniscus pokes out a little and you should be able to palpate a soft prominence. That is the meniscus. Next, we'll be palpating the MCL. Technically, it's not very palpable unless there is a dysfunction or if it's symptomatic. But to find the region, we're going to locate the medial joint line in the meniscal window. Then move medially and posteriorly along the joint line. This should be the region of the MCL and will become very tender when there is a spasm. Next, we will be palpating the pes anserine. You'll have your patient with their leg over the edge of the table. You'll stabilize the patient's leg by holding it with your own. Palpate the tibial tubercle. Move slightly medially and posteriorly. Ask the patient to attempt to flex their knee while you resist. This makes the tendons more prominent. These groups of muscles and tendons are known as the pes anserine. Just medial to the insertion of the tendon lies the pes anserine bursa. At the pes anserine inserts the sartorius, the gracilis, and the semitendinosus. Lastly, we will be palpating the lateral side of the knee. First, we'll be finding the lateral tibial plateau. So you start with your patient supine, knee flexed to 90 degrees. You will have your thumbs in the depression of the joint line and your fingers in the popliteal space. If you press inferiorly with your thumbs, you'll be palpating the tibial plateau. On the medial side of the patella is the medial tibial plateau, laterally. Next, we'll be palpating the lateral tubercle. So starting from the lateral tibial plateau, you move right below that and move laterally. You'll feel a large bone from it. Next, we'll be palpating the lateral femoral condyle. You have to have the patient's leg flexed past 90 degrees. You'll palpate its smooth surface right below the lateral side of the patella. Next, we'll be finding the lateral femoral epicondyle, which lies just laterally to the femoral condyle. Next, we'll be palpating the head of the fibula. So from the lateral epicondyle, move your fingers inferiorly and posteriorly following the joint line, and you will find the head of the fibula. It's at the same level as the tibial tuberosity, but it's on the lateral side of the leg. Next, we'll be palpating the lateral meniscus. It works best when the patient's knee is slightly flexed. You'll press firmly on the lateral joint space with your thumb, and you may be able to feel the anterior margin of the lateral meniscus. Next, we'll be palpating the lateral collateral ligament. It's best to palpate it with the knee flexed to 90, the hip abducted, and internally rotated. It is a thick cord-like structure that runs from the lateral epicondyle to the fibular head. Next, we'll be palpating the biceps femoris tendon. So you'll have your patient with their knee at 90 degrees. And the biceps tendon is the tendon on the lateral side of the knee that comes down and inserts on the fibular head. It becomes more palpable when you resist knee flexion. Next is the IT band or iliotibial tract. This is on the anterior lateral side of the knee. There are two ways to palpate it. First, you can have your patient seated, tell them to dig their heel into the ground. And it should become a bit more visible. Second would be to have the patient lie with legs fully extended. And do the same, please dig your heel into the ground. There we go. Our last palpation will be the common perineal nerve. It is palpable across the neck of the fibular head.